Part of many people's view of independence. Only a small minority of seniors are happy at the prospect of moving into a care home or nursing home, not just because a significant change like this can be quite distressing, but also because they're reluctant to leave their treasured possessions and memories behind. The CDC defines aging in place as the ability to live in one's own home and community safely, independently, and comfortably, regardless of age, income, or ability level. Cities are beginning to pay more attention to designing age-friendly streets and public spaces, and a growing number of services are available to help older people modify their homes to make life easier. There's a growing industry to help people age in place. For example, the National Association of Home Builders, for instance, now offers a training program for certified aging in place specialists who focus on refitting homes for older adults. And a directory of the certified specialists can be found at the website shown. Technology has also changed what it means to age in place, making it easier to bring goods and services to your door and offering new ways to monitor and protect your health. Aging in place isn't about avoiding change. It's about making adaptations to your existing home and lifestyle as you age. Even if you stay in your own home, you may at least make some alterations to accommodate changing physical abilities, as well as modifying some of your routines around the house. Don't automatically assume you need extensive remodeling. Focus on modifications on what suits your needs and lifestyle. Simple measures such as installing grab rails, ramps, or possibly a stair lift are measures that can help make your home a safer place. Other items that can make it easier in your home include adjustable tables, tools to turn doorknobs, lamp switch turners, and large button TV remote. So other practical aids for getting ready. There are many items that can help in the bathroom and with getting dressed, such as bathroom safety grab bars, bath and shower chairs, walk-in bath or showers, adaptive dressing aids, raised toilet seats, long-handle bath sponges and brushes, and long-handle hair brushes and combs. There are also practical aids for on the move. Several items that can help when you're out and in the car. These include key turners, tools to loosen gas caps, portable access ramps, personal alarms, a folding shopping cart, a walker, cane, scooter, and car transfer aids. And finally, some practical aids in the kitchen and for dining. There are adaptive eating utensils, tools to loosen bottle tops, reaching aids, and lowering cupboards in the kitchen can help as you get older. Now let's talk a little bit about mobility. So mobility is the kind of thing you take for granted until you no longer have it. When you're young and healthy, you never stop to consider how marvelous it is to be able to move effortlessly. You get out of bed in the morning, take a shower, then head downstairs to your kitchen to make coffee. You go for your daily walk around the neighborhood, or if you live in an urban area, you may walk to the post office, library, or gym. Later, you drive across town to meet a good friend for lunch, and on the way home, you stop at the grocery store, pick up a few things you need for dinner, then carry the bags back to the car and drive home. Even the simple, relatively uneventful day described here requires a great deal of physical stamina, strength, balance, coordination, and range of motion. Most of us spend our lives doing these very tasks day in and day out without marveling at how much our bodies can do. But when we lose these basic skills because of a health problem or a physical decline associated with aging, we begin to understand how much living well relies on being able to move. Mobility is broadly defined as the ability to move oneself, such as by walking, by using assistive devices, or by using transportation within the community environments that expand from your home to your neighborhood and other locations. Mobility is important for active aging, and it's linked to health status and quality of life. But limitations on mobility affect 30 to 50% of adults ages 65 and older. Some people are taking a more holistic view of mobility in that it's not just about physical mobility. Other determinants of mobility include cognitive, psychosocial, environmental, and financial influences. These determinants interact with each other and influence mobility to all kinds of settings and locations. For example, some of the cognitive determinants include mental status, memory, speed of processing information, and executive functioning skills that help us manage time, pay attention and switch focus, plan and organize, remember details, and do things based on your experiences. Some of the psychosocial determinants include self-efficacy, which is the one's belief in your capabilities to do something, coping behaviors, depression, fear, and relationships with others. The environmental determinants include driving at night or in poor weather conditions, walking on a slippery surface with limited lighting, stairs, and safety concerns. The financial determinants include affordable modes of transportation, places one can travel, residence in safe neighborhoods, and affordability of healthy foods and places to be active. All of these things can affect one's mobility. In today's presentation, though, I'm talking primarily about the physical abilities, but I'm happy to come back another time and talk about this holistic view of mobility. And the great news is that we can prevent mobility impairments or reduce existing ones. Improve your mobility. So engaging in physical activity is the single most important thing you can do to maintain mobility and independence, no matter your age or your health status. It can help control your weight. It's the key to keeping your muscles and bones strong, your joints working properly, your heart healthy, and your metabolism revved. The more you move, the better your strength and balance will be, and then less likely you will be to fall or lose the ability to perform basic daily functions. Physical activity guidelines for Americans recommend 30 minutes of moderate exercise a day, 5 days a week, or a total of 150 minutes a week. The guidelines also recommend twice weekly strength training sessions and balance exercises for older adults at risk for falling. Disability shouldn't be a reason to refrain from all activity. Be as physically active as your abilities and conditions allow. Find what works for you. It's important to talk to your healthcare provider if you're going to start being active and you haven't been active in a long time, or if you're feeling any unusual pain when you exercise. Well, balance is an integral part of mobility and maintaining one's independence. Balance can be described as the ability to distribute your weight in a way that enables you to hold a steady position or move at will without falling. Static balance helps you stay upright when you're standing still. Dynamic balance allows you to anticipate and react to changes as you move. Maintaining balance involves many complex systems in your body. It takes many parts of the body working together to maintain balance, both when standing still and moving around. It takes your brain, your spinal cord, your inner ear, eyes, your nervous system, muscles, and bones. So with aging, the sharpness and sensitivity of these systems and organs gradually declines. Some medical conditions and prescription medications may affect balance too. Beginning in your 50s, you may start noticing subtle changes in your ability to maintain your balance. Maybe you don't feel quite as secure standing on top of a ladder, or maybe you find that you're paying closer attention to your footing when going downstairs. These things are unlikely to slow you down much at this stage. But during workouts, it may be useful to challenge yourself from time to time with balance exercises. As time moves on, you may find that poor balance becomes a more serious problem. For older adults, balance is essential to maintaining good health, since physical activity can become difficult without balance. Poor balance not only restricts your movements, but can also lead to falls and resulting injuries. In the elderly, one fall can lead to fear of another fall, which further can restrict activity. Every 11 seconds, an older adult is treated in the emergency room for a fall-related injury. 1 out of 5 falls leads to fractures, concussion, or other serious injuries. Women are more likely to fall indoors, while men are more likely to fall outdoors. Practically all hip fractures result from falls, and at least 300,000 older adults are hospitalized each year for hip fractures. Good balance can help prevent potentially disabling falls, and good balance builds confidence and fosters independence. And there are many ways to help improve your balance. If you're having difficulties with keeping your balance, talk with your doctor. He or she may propose a physical exam, a medication review, plus further testing if needed. But there are a variety of activities that can improve your balance. Some of these activities are walking, bicycling, climbing stairs. These all can strengthen muscles in your lower body. And using a recumbent bike or a stair stepper is an option when balance is compromised. Resistance exercises help build muscle strength. You can use free weights, elastic bands, or weight machines to increase strength and improve posture and balance. There are core exercises which build muscles that can help keep a momentary stagger from turning into a bad fall. Stretches can loosen tight muscles, which affect posture and balance. Additional activities include yoga, which Julie's going to share with us today, which strengthens and stretches tight muscles while challenging static and dynamic balance. Tai Chi, a practice of slow, graceful movements that flow smoothly from one pose to the next and mesh with meditative breathing, is very good for balance too. Pilates is an exercise program that targets the full range of core muscles and challenges static and dynamic balance, enhances posture, and develops muscle strength and flexibility. And sports like tennis, soccer, and golf can strengthen lower body muscles, assuming you're walking from hole to hole on the golf course rather than riding in the golf cart. Now Julie's going to share some of those exercises that we talked about to improve balance. Julie, I'm going to stop sharing my screen. And after Julie leads us through those exercises, we can answer any questions folks might have or